Previously on John Wants Answers.
That guy with the white sweatshirt on doesn't know what he's talking about.
You may have a point there. There's nothing else in the room that says do not touch. This is the only thing that says do not touch. So I wanted to stick it to the man.
Yeah.
And touch it. We did a show on being gay. I thought that show was pretty good, but I was wrong. It was excellent.
Wow.
Excellent. Special audience, community producer for being gay. And then, not only did we win that award, we won the documentary issues at the Electoral College.
I went there briefly, but I dropped out. I didn't like the core curriculum.
And the professors didn't treat you nice?
Yeah.
Says, did John say he got an award for being gay? Yes, I won 2 awards for being gay. And my guest who's on the show, Armando, he's been gay all his life. And as far as I know, he has not yet got an award for being gay.
Those states suck.
They states suck?
Yeah.
Some of them were stricken down.
Some of them were stricken or suspended.
Stuck around.
Yes.
Stuck.
Some states do have voter ID laws.
Yeah. We had the results of last month's Keith and John Get It On. I got 4 votes, and then you got 3 votes. So I won by 33%.
No, 1/7.
1 vote.
18%.
You had 3 votes, and I had 1 more than that. I had 4
but there's
votes,
7 votes cast.
Yeah,
so
I want to spin this so it looks like I had a landslide.
you didn't.
Our new contest for November,
Yes.
we're doing a thing called Movember. Have you heard of Movember?
I have.
People are growing mustaches in order to support prostate cancer and male mental health.
I think they're not actually supporting prostate cancer.
Oh, they're like trying to opposite.
Yeah.
The next show,
Yeah.
December,
Yeah.
we're going to then compare mustaches.
Okay.
So you can't shave your mustache.
Oh, I can shave it.
Tune into our next show, December 13th. You'll see us in mustaches. It'll be hilarious.
Yeah, at least one of us.
And now,
I'm John, and tonight I want answers about prostate cancer in Movember. There's no stopping us now because we're live.
John wants answers. John wants answers. Give John answers. Give John answers. John wants answers. John wants answers. Give John answers now.
Check your calendar. If it says December 13th, 2012, then we're live. Although we got an email from a viewer last month when I said November 8th, then we're live. He was in the Eastern time zone. So his calendar was 1 day ahead. So if your calendar says December 14th, then you're in Eastern time zone and we're live. If it says December 12th, you are traveling through time. My guest tonight is L. Matthew Scala, or just Matt Scala, we call him. Why are you an expert tonight?
I'm an expert in prostate cancer. I'm an oncologist with Kaiser Permanente in Santa Clara, and I have extensive experience treating men with prostate cancer.
Oh, great. Thanks for being on the show tonight.
You're welcome. Thanks for having me.
You're very welcome. We'll be taking your tweets. So if you have any tweets for the doctor and I, more for the doctor, less for me, tweet us at John Wants Answer. There's no S on the end because the S is for suck, and we don't. If you've never seen the show before,
And you haven't.
the show's like a courtroom drama. I'm the prosecutor. My guest is the expert witness. And you at home and in the audience are the jury. And it's your job to convict or acquit the topics. We have a Twitter contest. Be the first to tweet and ask for a headshot. And you'll get this lovely promotional photo, which I will autograph for you and say nice things. Go to the internet on Facebook and like us. And while you're on the internet, go to johnwantsanswers.com and look at all our previous episodes. This show cannot be made possible without the support of our executive producers, Lisa Tamaki and Brian Westbefall. One of my favorite quotes about this show is, someone said this and sent it in, "I can't believe I'm watching this." We get that a lot now. Okay, after all that, we're ready to start our first case, John versus prostate cancer. All right, Matt. So prostate cancer is in the news for 2 reasons, maybe more. We just had Movember, which was November, but with an M.
We did.
People were celebrating, well, not celebrating, awareness for prostate cancer. And just announced yesterday, Jerry Brown, governor of California, came out that he has prostate cancer. So we're going to talk all about prostate cancer tonight. The topic of the show came up because I was talking with my wife, and I was saying, wait, do only dudes have prostates, or do chicks have them too? And she said, you got to do a show on prostates, because that's a terrible thing to ask, especially at your age. So tell me, prostates, guys only?
So it's a great place to start talking about prostate cancer. What is the prostate? Very important. Yes, only men have a prostate gland. It's actually located right under the bladder, and its main job is to produce the fluid component of semen. So yes, only men have them.
Only men have it. I heard about 10 years ago, someone discovered the female prostate. So are they making semen too? What's that all about?
So it's a very interesting topic, actually. There's something that's analogous to the prostate gland that females do have. It's something called a Skene's gland. They're very small, and they lie next to something called the urethra in the female, and that's the tube that drains urine out of the bladder. These are tiny and also can get cancer, kind of like prostate cancer, but that is very, very rare. So there's something analogous, but it's not really a female prostate.
Okay. So we talk what the prostate does. It makes this semen. Is it more susceptible to cancer than other organs? Because I hear a lot about how it's like number 1 or number 2 cause of cancer in men.
Exactly. In men, skin cancer is actually the most common cancer, but coming up second is prostate cancer, extremely common. About 250,000 men just in this country alone every year will be diagnosed with prostate cancer.
I think I read a statistic that said 1 in 6 men will get it. Is that right?
That's true. That's true.
That's quite a big number.
It is.
So are there things I can do to keep my prostate healthy?
That's another fantastic question. So people have looked at different things that people can do, that men can do to try and keep their prostate healthy. And they've studied nutrients and vitamins and supplements. And really the evidence is kind of conflicting. There was originally some evidence that maybe vitamin E can help reduce the risk of prostate cancer, and something called selenium, which is another type of supplement that people can take. But more recent studies have not panned that out, unfortunately. And what always kind of comes back is just doing things that kind of our grandmothers always told us to do, like exercising and lots of fruits and vegetables, and just living a generally normal, healthy life is kind of the best thing that people can do.
Okay.
And of course, you know, screening as well when that comes time to do that.
So is there the thing about the, I guess it's a myth, that vasectomies will affect your prostate? So there's nothing to that? There's
nothing to that. You know, there was originally some research done many years ago that seemed to show a link between having a vasectomy and development of prostate cancer later on, but that actually has been disproven.
So vasectomy is basically tying up the tube that goes from the prostate to the testicles?
Exactly. Right? It's cutting off that flow. Exactly.
Right. Does all the fluid just back up in the prostate?
So the fluid actually does not back up in the prostate. It's kind of naturally resorbed in the testicles, and so a man who has a vasectomy doesn't notice any symptoms at all from it.
Okay. I also had read or heard somewhere masturbation. Does that affect?
People have really studied that a lot, actually, trying to figure out, you know, trying to get that Nobel Prize, but, you know, trying to figure out if there's a link there. And again, conflicting evidence. Originally, some studies came out that looked at men that had ejaculated more often than others and seemed to indicate that they're at lower risk for prostate cancer. When larger studies were done to try and confirm this, that link hasn't been shown again, so the jury's still out on that one.
Well, I hope they're still working on that. Okay, so when I neared 40, my annual checkups took a turn for the worse. So about 35 was the turning and cough.
Yep.
Right. What is that checking for?
So that's actually checking for a hernia. A hernia is an abnormal protrusion of bowel, small bowel that's in our abdomen that's supposed to stay in our abdomen that goes down into near where the testicle is. And so that's checking to make sure that's not there.
Okay. And then later, when in my later 30s, there was a more invasive checkup where I had to lie on my side, and then the doctor put one of these on, which he made it look really easy when he did it.
Here's the medical form.
So I lied on my side and put my knee up, whatever, and then this came out, and there was a check.
Yes.
So what was happening there?
So that is something called a digital rectal exam. Sometimes you hear people refer to them as a DRE, just the initials for that.
Digital means something totally different in computer science.
Exactly, exactly.
It's a good thing.
Right. Digital here just means the digit, the finger, exactly.
Okay, so which finger do they use?
The index finger, the good old index
This one
finger.
here? Okay.
Yep, that's the one, exactly. And that is just solely to feel the prostate. The prostate, it lies right in front of the rectum, and so it's easy to feel it and easy to feel if there's any abnormal lumps or bumps that could be signs of cancer.
So you're feeling to see if it's larger?
If it's larger, exactly.
Or if it's harder?
Exactly, if it's harder, or more specifically, if one part of it is harder than another, which could be an indication that that's a tumor in that part.
Okay. So if I'm not getting the regular checkups from my doctor, are there other symptoms I might notice to make me think I should get my prostate checked out?
Yeah, that's a great question. Really, symptoms of prostate enlargement or prostate cancer have to do with urination. Things like urinating more frequently, having to get to the bathroom more urgently, or having blood in your urine. Those types of symptoms can be a sign of either just regular prostate enlargement or, in some cases, prostate cancer.
Oh, okay. So that's something to look out for. So let's say I see you and you tell me, John, bad news, you have the prostate cancer. What are some of the treatment options?
So there's really three main treatment options for prostate cancer that we use nowadays. The first is surgery, removing the prostate. The second would be radiation therapy using high energy X-rays to kill the prostate cancer. And the third is something we call active surveillance, which really means that we've diagnosed a prostate cancer, but it's not likely to ever become life-threatening. And so we actively follow those patients with PSA blood tests that we can talk more about later if you like, and exams and other ways of following them to ensure that their prostate cancer isn't growing or changing or becoming more aggressive. And so this is one of, the best ways actually to treat prostate cancer in appropriate men, because it spares them of some of the bad side effects that could be from surgery or radiation therapy, while following them close enough that if their prostate cancer were to change or grow, you can still treat it while it's early and very curable. And so what we really take advantage of there is that prostate cancer, while it's potentially life-threatening and can be dangerous, in general is a very slow-growing cancer. So we are able to use techniques like this.
So I can just keep an eye on it.
That's pretty much what it is. Just keep an eye on it.
Take an aspirin, call me in the morning. In surgery, they take out the prostate.
That's right.
So beyond reproduction, the prostate doesn't have much use beyond that?
Beyond reproduction, the prostate really, that's its main role. So most men, will notice some change in those reproductive functions, semen obviously production, after either radiation or surgery. Besides that, most of the side effects of treatments have more to actually do with urination type symptoms than anything else.
There's no erectile dysfunction?
There can be erectile dysfunction as well, and sometimes bowel problems as well, rectal problems. Those are the main three.
Okay. So what's the prognosis if I have been diagnosed?
Sure. So
chances are good. I heard 1 in 33 people who are diagnosed die from it. So those odds on itself sound pretty good odds.
Right.
But what can you say about that?
So it's actually very dependent on the type of prostate cancer that someone has. It kind of gets back to what we were talking about before. in that not all prostate cancer is alike. Prostate cancer is a very, what we call heterogeneous disease. In some men, it's going to behave very, very well, and the prognosis is excellent, really near 100% cure. And in some men, it's going to be very aggressive and potentially life-threatening. So the prognosis really depends on really three main factors: what we call the tumor stage, how big the tumor is in the prostate itself. The second is called the grade of the tumor, or something we look at called the Gleason score. And what the Gleason score is when the prostate is either biopsied or removed, the doctors look at it under a microscope, and they basically give the cancer a score between 1 and 5, with 5 being a very aggressive, very dangerous looking cancer, and 1 being something that looks almost like a normal, healthy prostate cell.
Right.
And also the PSA. The PSA is a blood test. PSA is a substance that's produced by the prostate cancer cells. And we know from many, many research studies that have been done that the higher the PSA is, the riskier the cancer is, and the more potentially life-threatening the cancer is. So we actually have developed systems to put those three factors together and be able to give patients an estimate of their risk of having an aggressive cancer and their overall prognosis, which then gets back to who should we really treat with prostate cancer and how aggressive do we need to treat them, because prostate cancer is not a one-size-fits-all disease. It's a very, very individualized problem with individualized treatments.
Okay. Besides the cancer, what else can go wrong with my prostate?
Sure, there's several things that can be happening in the prostate that are not cancer. One general class of things are just infections, just like you can get a lung infection, like a pneumonia. The prostate can get an infection, something we call prostatitis, which we then treat just with antibiotics like other infections. There's another class of problems that's called benign prostatic hyperplasia. You may hear it referred to as BPH, and this is enlargement of the prostate not due to cancer. The prostate really has kind of two major parts. The part towards the front can enlarge and cause those urinary symptoms that you see kind of on the Super Bowl commercials, and they say, are you getting up at night often to pee, take this medicine? That's what's called BPH, and that is not cancer. That is just a benign, what we call benign, which means not cancer, enlargement of the prostate. And then the back part of the prostate, the part that sits in front of the rectum, that's the place where typically cancer happens more often. So, infections, this BPH enlargement, prostate cancer, these are all kind of the common things that can happen.
All right. I think we have a picture that we have drawn of the prostate and the parts. Okay, if you can see it from way over there.
Okay.
So in case you're wondering, there's the prostate. Right near the rectum, and it feeds things to the testicles. We had the picture, so I thought we'd show it.
That's a good picture.
Yeah. Okay, we have to stop for a break now.
Okay.
When we come back, we are going to take your tweets, and we're going to talk more with Dr. Scala about prostates and cancer. And don't forget, Keith and John get it on. We're going to take care of this bad boy. Okay, we'll see you in a minute.
Clear?
All right. So, did we get to all the highlights?
I think we did, yeah.
Do you think anyone's going to have any more questions about prostates?
I don't know. I think we covered a lot.
We're going to see our tweets now and see if anybody... I want to get this off.
8 years of medical school, man.
Oh, then your hand gets all sweaty under those things. I guess you want...
Rubber gloves is most of the second half of the second year.
This is latex-free vinyl gloves. That's what these are. I tried to find latex gloves. Do they not sell latex gloves anymore?
Not so much, because people have latex allergies, so they try to keep them latex-free.
There's a good question. There's a good question there. We only have one question.
What's the question?
Is the digital exam painful? I wouldn't say it's painful, but it's very
uncomfortable,
awkward.
Yeah.
It's uncomfortable and awkward, and afterwards the doctor and you don't want to look to them in the eye for a bit. That was my experience. Okay. We need to get the hot water for my shaving. Someone bring unto me in a shaver and shaving cream.
Good luck
That's
getting,
all by you.
good luck getting hot water.
Uh-oh.
It's probably going to be cold, John.
Do you don't have hot water here?
We got it, but it may take 15 minutes.
Station doesn't have that much money.
Oh. After 8 o'clock, they turn off the hot water heater.
So it may be cold, but it'll be water.
Great.
The only thing I can guarantee
Did she
is
say the
that'll be water.
shaving stuff is near you?
The shaving stuff is near me?
Yeah, it's over
Um.
on the floor maybe.
Oh. Oh, yes, indeed. Let's get see what we're going to take the tweets. And that's it. And that's a show. So where do you work? At in Santa Clara?
Yeah, Santa Clara, right at Kaiser.
At
Yeah.
Kaiser?
Mm-hmm.
How's that? You like it there?
Yeah, it's great. Yeah, it's fantastic.
That's a new hospital on the corner of Lawrence and something?
Homestead.
Homestead.
Yep. Lawrence and Homestead.
I remember when that was just an empty field.
Did it work?
What camera isn't on?
What camera is on?
Greg, we're on in 5, 4, 3, 2.
And we're back, and we're taking your tweets. And we have one tweet from Stacy Tamaki. Is the digital exam painful? That's the exam you're telling me that involves a latex glove
Mm-hmm.
and feeling around the rectal area.
Exactly. So the digital rectal exam is a quick exam, usually only takes about 15 or 20 seconds, and shouldn't really be painful. Definitely can be uncomfortable, if that makes
Right.
sense, but real pain shouldn't be too painful.
And if it is painful, it means you've got bigger problems.
Yes, potentially.
Okay. So that's the tweets. So I hear about prostate cancer. I also hear about pancreatic cancer.
Mm-hmm.
And the pancreas also starts with a P and has 2 syllables. So I'm wondering, how related are they? Are they totally different organs? Or what's the deal
They
there?
are 2 totally separate organs. The pancreas actually lies in the middle of our abdomen here by our stomach, and actually helps us digest food. It makes enzymes that help us digest the food we eat.
Okay.
So other than starting with P and potentially having the same amount of syllables, I mean, we're going to have to check that, may have not too much else to
Okay.
do together.
And since women eat, they have a
That's right.
pancreas too. Okay. Well, thanks for talking to us.
Sure.
It's been a pleasure.
Absolutely.
And I learned a whole lot about the pancreas and the prostate. So remember to go out and get your prostate checked. It's unpleasant, but it'll save you in the long run. Because early detection is the key, right?
Absolutely.
Right. Okay. Next up, we're going to do Keith and John Get It On. So Keith can come up now, and we're going to vote on the best mustache. So I'll give you a ballot. And can we get the bailiff? Harpreet the bailiff, can he come up and hand out the ballots? And we have some pencils here. So you're going to... Hey, wait. Okay. First of all, your mustache is coming off on this side.
It's cancer.
Okay. While they vote, we're going to try and shave off my mustache. Would you like to shave off your mustache too?
No.
It's quite nice.
Yeah, well, I put a whole week into it.
What does the girlfriend think of the mustache?
Not a fan.
Not a fan?
What about yours?
Oh, she's unhappy.
What does the wife think about it?
Yeah, the wife's unhappy with it.
Oh. And the girlfriend's
No.
unhappy with it too.
There is no girlfriend.
Good answer.
Okay, so I'm going to shave off this mustache right here in front of us. And while we do that, we're going to talk about Movember.
Okay.
So, when do they spell mustache with an O?
It's French. The French spell things with weird letters
The British too.
because they know it annoys the English.
But the British spell that way too. I think only
They do.
Americans don't have the U.
Well, Americans have a U in mustache.
Yes, they don't have the O. But Canada and Britain have the O. Okay.
Yeah, who knew?
When did Movember begin?
November 1st.
No, I mean like when did the movement begin?
Well, like 10 years ago.
10 years
10 or
ago.
12 years ago. It was recent. Movember couldn't exist until hipsters were invented.
Oops, I'm doing this out of order. I meant to like cut off my mustache first with the scissors.
This is very complicated.
I should.
This is why I generally shave every couple days. With the nice electric razor.
Why don't you
That's
talk
right.
more about
Yeah.
Movember while I'm doing that?
Movember is a fundraiser. It's the word November, except you replace the N with an M at the beginning, and then you need to be all hipstery and stuff and talk about it. And in theory, you're supposed to be allowed to grow a fake mustache starting November 1st, and you're supposed to shave it off at the end of November. So you have done it wrong, both
But
in the start and end date.
We have a show to do, so you know,
And
we had to do it differently.
and then you're supposed to donate money to prostate cancer. Did you donate money to prostate cancer?
No.
Did you bring your wallet?
I'm raising awareness.
There's a guy right next to you. Would be glad to take your prostate cancer donation money.
Matt, can you accept donations on behalf of the prostate?
I cannot personally
Cancer-
accept a donation, but there's lots of great prostate charities out there that would love to take your donation.
Can you name some prostate cancer people who people should give money to?
I think the California Prostate Cancer Coalition would be a good start, and they can definitely plug you into all kinds of different.
I can shave faster than you can too. This is taking forever.
Yes, it is. What else?
I would have shaved like 3 times in this time.
So how come? So mustaches were big in the 70s,
Yes.
and then they got out of fashion a little bit.
Yeah.
Why are they so associated with adult film actors from 1970s? I mean,
I've never heard that.
everyone
before.
had mustaches. Why are they getting the bad rap?
Well, I think because generally we don't watch TV from the 70s anymore, but we still watch porn from the 70s.
Who watches porn from the 70s?
These kids today.
Kids today. Okay. Hello? What? Who won? Have we got the votes back?
Yeah, the ballots are by the doctor.
Oh,
These here?
yes. Let's have the doctor add them up because the doctor is more trustworthy than
Do I
either
get to
of us.
vote? Do I get to vote?
No,
Sure.
we don't get to vote
Why don't we get to vote?
because we're in the contest.
I'm an American. You should at least get to vote.
Oh, I have one. Yep,
Oh,
I
he
voted.
voted.
I voted, yeah.
Yeah.
It's like landslide.
Is it a landslide? Okay, I'm being told that
So
our time is up.
It does look like a landslide. It is John for the win.
Woohoo!
Yep.
5 to 3. 5 to 3 is
5 to
hardly
3.
a landslide.
And look, it's
49
all
to
gone.
1. 49 to 1 is a landslide.
All right, well, that's our show. Our next show is on January 10th, 2013, or if you're on the East Coast, January 11th. All right, good show, guys.
This thing did not hurt. I have no idea.
Did you say it?
This man went to medical school.
All right.
You may